Hi, I'm Dr. Margriet Barnard, your host of the Birth and Baby Show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms, midwives, and birth workers to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust. This episode is proudly sponsored by Zero BS. When you're pregnant, breastfeeding, or caring for a newborn, you become acutely aware of what goes onto your skin because it ends up on theirs. Most commercial mom and baby products are still built on petrochemicals, perfumes, and preservatives that have no place on a newborn's body. Zero BS takes the opposite approach. Our Telorin-based formulations use purified, stabilized tallow, a fat the skin immediately recognizes. It's safe, edible grade, and completely free of toxins. Our nipple balm is clean enough for a feeding baby. Our baby bum balm protects delicate skin without any synthetic films or fragrances. And for new mothers navigating inflamed, sensitive skin, our healing balm brings immediate comfort without chemicals. And our body butter helps with stretch marks. Zero BS, real protection for you and your baby. Visit www.zerobs.co.za. Hi and welcome to another episode. For today I have a special guest. Her name is Lungile, and I thought for the end of the year it's good to just focus a bit on our own health, overall health and well-being, and especially the effects of our modern living. And Lungile has got an interesting story and a journey in health and well-being, and she also happens to be a midwife. So Lungile, I'm so glad you're here with me.
Yes, thank you for having me.
How are you?
I'm good. How are you doing?
I'm good. I'm excited for this talk.
Likewise.
Yes, you've got lots to share. So Lungile, tell the listeners and the watchers a little bit more about yourself.
Okay, so I'm a midwife, very exciting to be one, challenging as well. So I think that's just a very big part of my life because it takes up a whole lot. I'm sure you know our working hours and all, but I'm also just a young woman who is just really passionate about life, passionate about helping women, and just really being a part of you know how in The Lion King, the movie, the circle of life.
Right.
So I'm just really just passionate about that, finding my place in the circle of life and just doing the best that I can to impact people's lives and effect change as well. Which brings me to also just, I guess, another important part of who I am, you know, and what I do. I'm also the founder of an initiative called With Sis. You know, as the name suggests, it's just being with women, you know, and just really taking them as my sisters, and them, you know how in South Africa we call being a nurse or midwife sisters. So yes. I think just the play on that is also quite interesting, where they also just refer to me as Sister Lungi, but they're really my sisters as well.
That's so beautiful.
And just walking them along in their journey on health and well-being as women, and also just that stemming from my own experiences as well. I'm sure we'll just discuss more of that as we continue.
Yeah, so I got to know you as a very passionate human, a young, passionate woman, beautiful, and there's a lot about you. So you are very passion and purpose driven, right? I love what you've done with Sis, and tell us a bit more how that started.
Yeah, sure. Started very wild, actually. I know it sounds so lovely now, but it really just started from my own experience as a young girl growing up and getting to that stage in her reproductive journey of, you know, entering into my menstrual cycle. So it started off okay, but I think later on in the years, in my late teens, early 20s, I struggled with very bad menstrual cycles, menstruation, where I didn't have so much period pains, but I would get very bloated, I would vomit a lot, I'd get very tired during that time, and just overall not feeling well, you know. So that used to really worry my my mom more than it did me, because she didn't really know what to do with me, you know. And I think just trying to help myself as well, I would, you know, just, I guess, eat things that would make me feel better, you know, like chocolate and just some things that, okay, if I don't have appetite, because that also used to be like one of the symptoms that I'd experienced, just a loss of appetite. So I'd go for like foods that taste a little bit better, you know, and we all know foods that taste better aren't always, you know, the really right ones for us. So that's really what I would do. And then obviously, you know, I think what baffled me a lot was also that I you know, roughly around this time, I had already entered into my training as a midwife, as a nurse. So I had all this knowledge, but it was so shocking that, you know, with all this knowledge that I have, you know, well, I mean, obviously not a lot because I'm still a student, but still somewhat of, you know, medical knowledge, I still couldn't really, you know, understand what was going on with my body. And okay, so I obviously did go for wellness checks, you know, gynecological visits and get that checked out. And it still didn't quite help me, you know. I think what it did, the most important takeaway was just the importance of being aware of my cycle and just taking note of when certain things happen throughout my menstrual cycle. I think that's what I can take away from those checkups. And obviously just tying it all back again with the, you know, some of the knowledge that I had from school as a training midwife and nurse. So, yeah, and then I guess with that frustration of not knowing what's going on and also not really getting the right help, I just decided to embark on a whole research journey of my own. To really, you know, find out what's out there, what do journal articles say, what do some people say, you know, obviously trusted experts in the field. And I got to find out that, you know, actually there are so many lifestyle factors that influence how we as women go about our menstrual cycles. And, you know, that's roughly like 28 days. You know, I mean, it is, you know, the whole cycle is 28 days and, you know, on average, I don't know, women go to their periods for how long? Probably like 7 maybe on average. I'm not sure of that figure. But can you just imagine, that's a huge chunk of your time and life. Yes. For you to go about it very unhealthy and just not well. You lose a lot of time off of work, school, you know, it really just has a lot of impact on day-to-day life. So anyway, so with my findings, I found out that what I eat, what I put on my body, you know, I mean, we learn about these things at school, but sometimes it's like we can't really practicalize them. You know, the fact that your skin is actually an organ and the largest one for that matter. So whatever you put on it has a role to play in your health, right? So, and also what I wear, the containers that I use, you know, to put my water inside, what I cook with, and also the psychological factors as well, you know, like stress levels, influence directly how I go about my cycle. So yeah, just a whole lot.
So it was a whole new world opening up for you there then.
A whole new world. And I think it was also empowering, you know.
Right, so what a beautiful journey. It's always personal journeys that lead us to discovery. Yeah. So, and I think your journey is, your experiences, so many women can relate. So that I don't function optimally in the cycles, and the advice or the medical help out there is not sufficient because we're not going to the root cause. Why are we seeing so many problems, right? So, there's so much I want to ask you now. Let's first talk on your own journey before we get to the women you're helping. And for the listeners, what was the discovery then? What is the deal with all these things that you discovered, like the stuff you put on your skin and the products that you use and the clothes you wear? What's the deal there?
Yeah, so I found out that, for example, right, with what I put on my skin, there are certain ingredients in, you know, cosmetic products, lotions, also hair products that have substances that are endocrine disruptors or hormone disruptors. So as you know, as women, we have so many hormones. It's a festival of hormones.
Yeah.
You know, so if anyone goes a little bit off balance, that's what causes the whole mess, right?
Correct.
So I realized that actually, you know, some of these cosmetic products that I would use would contain, you know, the specific name is parabens. And, you know, also with my hair products, the sprays that I use. And I also just went on a journey where I stopped relaxing my hair. So there's a whole phenomenon. I mean, I know we all have like a, you know, an option as women to choose what kind of hairstyles we use, but it's also important to know that sometimes, you know, what we do does have like, you know, a direct impact on our health. So I discovered that, there are certain products that I'd use on my hair that actually disrupts my hormones, you know, and yeah, so as far as that's concerned, that's what I discovered. And then also with foods, that a lot of the foods that we cooked with at home, or rather the spices that we cooked our foods with, not spices per se, but like just flavoring agents, you know, contained hormonal disruptors as well, you know, things such as MSG. This is also quite a lot, it's found a lot in snacks, you know, as a student. I mentioned that I was a student at this time, so I was a very big fan of snacks, still am, but it's taken a slight different turn, right? So yes, MSG is a huge contributor to just our hormones being offset and off balance. And also I made a change with just, remember I mentioned like containers. So there are certain plastics that have, you know, that influence just the water that we drink from it. And these plastics have like PBA, right? So I don't know, I'm sure a lot of us have seen that, you know, some plastic will write no PBA. So that's actually another, you know, contributor to, you know, hormonal disruptors and so forth. Yeah, and also just with what I wear, I realized that, you know, as an active person, you know, I realized that, you know, tights and stuff that are made of like synthetic fabrics like polyester, spandex, they have a role to play as well. In, you know, of course, I'm sure you have the whole imagery of how gym looks like. We sweat a lot, you know, pores are opened, and obviously like being my skin, like we mentioned, being an organ, it does absorb some of that, you know, from the fabrics that we wear. So I did make some of those changes, you know. I'm still on a journey of discovering and also, you know, haven't really fully perfected applying all that I did find out. However, I found that just with like little things, like, you know, the things that I use every day, and just making amendments there did help me quite a lot, you know, with also dairy. I love dairy products. You know, I'm always a fan of cereal bowls with milk in the morning, you know, cheese girl with pizza and all. So I actually found out that that's also another thing, you know, dairy being a very hormonal food, right? Or milk substance, milk, for example, because it, you know, obviously comes from the breast of a cow, you know, and as we know, even with women's breast and the milk that comes out, it's very nutritious, yes, but it's also very hormonal. So, and you know, with some of the things that happen in these industries where for mass production and profit over health, you know, some of these cows that produce the milk will be injected with various other hormones to make them produce more milk or grow faster. So already on top of the hormonal festival that's happening, there's still some synthetic hormones that are injected, and, you know, we also intake them through eating, right, and ingesting some of these dairy products. So I did make, you know, just changes there with you know, avoiding, for my cereal bowls, you know, using maybe things like almond milk or coconut milk, and yeah, as a replacer for cow milk, you know. And of course, I have my cheat days here and there, but it's not all the time. as I used to. I think just that awareness also does help.
Yeah.
And meat also, right? For those of us who do eat meat, it's also important to know that, certain, same principle with the cow and, mass production, injections sometimes being put into these cows or, animals to make them grow faster so that, they, the industries produce more, right? Not all of them, I'm sure, there are some very responsible farming practices, but just also that discovery that going for more free range options as far as my meat is concerned is also quite beneficial. So I did certain things like that, and instead of plastic, I would use glass to put my water inside.
Amazing, yeah. Sure. There's a lot of things that we can become aware of and introduce change. And I like it that you said it's a journey and you're still on it. Personally, I also am aware of that it's like every time you discover something that's actually really not good for your health, you try to introduce a better option. And I don't want everyone to get overwhelmed. There's so many changes to make. But it is something that we need to be aware of, that we're so overloaded with hormone disruptors and toxins, and it's like bombarded at us from all corners. So how did that filter through to the work you do with the women now, with cis?
Yes. Okay. So, upon discovering and upon, seeing how I'm also helped, I go through my periods very well now, not a lot of, I don't feel ill like
Wonderful.
how I used to. So then I realized that, I really believe that knowledge should be accessible, and easily so. That even a 5-year-old can understand what I'm talking about when I talk menstrual cycle or hormone disruptors. So then that I guess inspired me to take this knowledge out, especially to teenage girls, adolescent girls, young women who sort of face these challenges. So I began to do just outreaches in schools. Where I would, talk to young women, adolescent girls about their menstrual cycles and also just some of these things that I have discovered in my journey, because there would be, a huge number of questions afterwards, young girls coming at me that, I have this experience, I have that, and as I started it off very informally. So, upon all of these requests, I just thought, okay, I think I should find a way to, formalize this. And as time went, I expanded it to, young women, older women as well, with menopause, because it's also such a hormonal shift in a woman's cycle. And also began partnering with other organizations that are doing similar work, but just sort of lacking this kind of approach that I am coming at it with. And that's just how it started, so it's just now also evolved into having a community of women, and where we speak, where women can just freely ask questions, and also just I'm very big on using a very holistic framework when it comes to healthcare. Even in my practicing as a clinician, I just believe that health should be very we've learned that it should be biopsychosocial, spiritual as well. So it's just looking at things, from that perspective.
Oh, it's so beautiful. Such important work. So with all these teenagers coming to you with all the questions, what are some of the most common issues that we see way too often? So for the listeners to identify that, hey, maybe I must look at my hormones, my hormone cocktail. What are all the issues that we see as cause of this?
Yes, sure. I think bad menstrual periods, like period pains. Let me just put it as simply as that. A lot of us as women have normalized very painful periods.
Right.
And it shouldn't be that way. Obviously some just cramping and, discomfort here and there, but not very bad period pains where every month you know that I need to stock up on some anti-inflammatories. No, that is not normal, to such a point where there are women who are I've seen young girls at schools that would not go to school at certain days because they just are on their period. It shouldn't be that way.
No.
You know, just our periods shouldn't interfere with our normal day-to-day functioning and activities. So as soon as you realize as a woman that, oh, wow, I can't function because I'm on my period, that should be the first red flag.
Absolutely. Yeah. So that is very clear, and I think for every female a reality. So we've normalized pain, but it shouldn't be like that. So it can be better, and we can have better quality of life. I think there's also a very, very high incidence of endometriosis, polycystic ovarian syndrome, and the common treatment is just put you on a pill or something. I don't know how your experience was with the medical help that you got, with the advice you've been given to solve these issues.
Sure. I mean, fortunately, I was never, I mean, I think I would have also revolted if I would have been that patient that default, which is bad. Please don't do that, you know. Do it with consultation with your healthcare provider if there is something that you that you're not quite agreeing with, right? I think that's just the responsible thing to do, and not, you know, keep quiet about being prescribed certain prescriptions and then you just default. No, don't do that. But it's important to engage with your healthcare provider. So I did engage, and I also did sort of encourage further tests, you know, like just to see how my hormones are sitting at, you know. But no, never was I given, you know, contraceptives. That was initially, you know, some of the talks that I would see surfacing, you know, during consultations. But I was very clear that, you know, if there is like an alternative route, you know, can we please rather explore that? So it's very important for listeners to just really not be afraid to talk to their healthcare providers, you know, and just ask questions. It's not supposed to be a passive process where you sit and you are just given what to do, right?
Yeah, we've totally moved beyond that, eh?
Yes. So yes, I think you know, because yes, and just being a responsible individual for your own body is quite important.
Yeah, absolutely. It is very important. So knowledge is power in this regard, and it's good that we're learning more and more as we go. As you said, you started to read up, and I think it's a very hot topic these days. I don't know about everyone, but I just see it everywhere. It's probably with the social media algorithms, when you start following certain pages, then you feel like the whole world is talking about endocrine disruptors.
Yes.
So it's also what you feed yourself, but there's a lot of awareness out there, and it's very timely. Maybe for some almost too late. I wish for myself I knew a few things earlier in my, you know, journey. So let's try to make it a bit practical for our listeners. What are, if you would say 5 things you can change your daily life right now? You've already mentioned like changing products and food, but often it's perceived like it's getting too expensive, or it's for a, you know, it's not feasible for you. But just some simple tips, advice on what you can change to support your hormones and your health.
Yes, yeah, it's just normal day-to-day things, right? So like I used as an example, like maybe changing your water bottles, you know, instead of using those plastic ones, perhaps just go for glass. So what I actually did, I didn't go out buying, you know, glass bottles, no. So at home, I have younger siblings, you know, at the time when I used to live at home, and, you know, really loved tomato sauce, you know, and a lot of the times tomato sauce comes in, you know, that glass container, the bottle. So after it's finished, I would like wash it nicely, sterilize it in hot water, and then take out the labeling, and that would be my water bottle.
Brilliant. Exactly.
You know, so it's certain things like that you can just do, right? And it's big enough, you know, and it's also good for the environment because it's not plastic, it's glass. You can reuse it all the time. And also, I guess...
And same for containers, for food leftovers, or there's so many glass containers we can wash and reuse. And
reuse.
Yeah.
Yes, definitely. And also, you know, I mean, with like... what I put on my skin, you know, I went for, because I sometimes found it as so much admin having to like go out and read these labels when I go out shopping for my cosmetics. Yes. So I just figured, you know, maybe let me just do the natural stuff like shea butter. So like, you know, you can just use shea butter. It's very good for your skin, you know, especially for those of us, you know, if you are someone who suffers from very dry skin, especially during winter, eczema, you know, very, very good, right, for the skin. Because I know I'm not gonna read, if it's shea butter, organic, I can just use it. I don't have to like read the label. You know, so things like that. And, you know, you can also use shea butter for everything. Like, well, not everything, but like for my hair, I use it as a lip balm. I use it for my skin.
Amazing.
You know, so you can just also just start doing some things like that, simple little things like that, you know. And also, like, for example, if you can't do everything, like I think just focus on what you eat every day. So if you know that you are a meat lover or you love, for example, maybe dairy, you know, every day you need to have that bowl of cereal with milk or that coffee with milk. You know, you can maybe just make that change. Start using alternative milk products instead, you know. And there are some, I know some people are just like, oh my gosh, almond milk tastes terrible, you know.
Yeah, it's not the same.
It's not the same, you know, but there are other, you know, milk products, alternative milk products that actually taste really good, you know, like macadamia. I think that's my favorite right now. Macadamia, the nuts, right, the milk that comes from that macadamia nut, it's I think that's really, really lovely. So just little things like that. And instead of using, you know, those flavoring agents, you know, in our daily, because I mean, we love good food, you know, our food should taste good. So instead of using those things that have MSG, rather go for like more natural spices.
Your herbs, your spices.
Yes, yes, that's also a good way to go about it.
And home cooking, I would say.
Home cooking, because you know what you're putting in your food.
Yes. I think it's all those on the way eating that disrupt a lot also, hey?
Yeah.
It's back to how it used to be.
Yes.
It's back, like when I do health education for the women I worked with, I say like, what did your grandparents used to do, you know?
Yeah.
Eat off the land, they did.
Yes.
They had wholesome food.
Yes.
They probably had proper 3 meals a day. They were outside a lot, sunlight,
with the sunlight,
working naturally, moving their bodies. Yeah. So in a modern lifestyle, it can be challenging, but can be done. You've showed us typical, like a next generation young professional. I disrupted you in some more advices you can give. But if you have anything else to say, like just to encourage the listeners, and yeah, no matter what age, it's relevant.
Yeah. Sure. So I think we've already touched on the most important thing, you know, which is like if you go about your period and you feel like, oh my gosh, I can't do much except if I have like painkillers. That is, you know, number one thing that you should look out for. And also I think what it is, you know, it's not a burden to have periods and menstrual cycles. It's actually, I look at it as like a vital sign. You know, it's like my extra vital sign as a woman that, you know, I can really embrace, because I know if my periods aren't so very pleasant and seamless, then there's something that's not well in my body, either psychologically, biomedically, or spiritually as well. You know, I think I always just pause if maybe, you know, with this journey that I've been, where I really go through my menstrual cycle really well, but for some reason, maybe I sometimes feel like, today I just feel a bit, you know, then I know that, okay, let me pause a bit and just try to reflect and think about what actually has been going on. So it's a blessing, you know, we are blessed as women to have menstrual cycles.
Absolutely.
It's beautiful.
It's beautiful, and you embrace it, and it becomes actually beautiful.
Yes.
Vital sign. I love that. I also love that how you feel differently through your cycle, and that it's actually quite natural. Like through your the week before your PMS, you actually want to just get a bit more safety, be a bit more calmer, and take it a bit slow. But then when the week before your ovulation, you want to be out there, and you like have got lots of energy, and it's actually such a beautiful rhythm that as women we should embrace and know that. I like also using an app to just track my cycle, so that can be extremely empowering for women. Also to know when it's your fertile window, and to even take ownership there, that you don't necessarily have to depend on all these, let us say, it's very chemical birth control pills. That is a whole story for another day, I think, the effects of those. It's just empowering. So I think, Lungi, you've inspired, got a lot of people to now like, I want to know more, and we'll dig deeper. If there's any of your favorite resources out there that you would like, or accounts to follow, or your own account, you can share it now with the followers.
Yes, okay, so you can follow me on Instagram. I think that's where I'm most active. LinkedIn as well, some Facebook. Yes, I must actually get better at. But yes, you can follow me on lungi.gamete on my Instagram, and also I have an account for my initiative. It's called With Sis. And also women that have also helped me, certain healthcare providers are, I think one that's very notable right now is Dr. Aviva Ram. So yes, please do follow me. And then on my LinkedIn, it's Lungile Gamete, Facebook as well, Lungile Gamete. And yeah, I think that's...
Oh, amazing. Thank you so much for sharing your personal journey and the work you do, and sharing so much valuable information. It's life-giving. So why not, I mean, December, January is always when we have these New Year's resolutions,
yes.
right? It's a good time to think of certain things you want to tackle. So if you have a holiday, you have time to reflect and listen to your body and what's going on inside. Just figure out where it is that you can make some changes for a really healthy, flourishing new year.
Yep.
So happy holidays.
Happy holidays.
And here to empowered women
Yeah.
and healthy women. Thank you so much.
Thank you for having me. Thank you so much.
Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.